Let's talk about human papilloma virus. Human papilloma virus is an STI, that's a sexually transmitted infection that affects both male and female. It affects both men and women. Now, human papilloma virus can be manifested. That is, the signs and symptoms of human papilloma virus includes cervical dysplasia. We're talking about cervical dysplasia, we mean the abnormal changes of cells on the cervix. We have itching or burning sensations around the genital areas. We have genital warts. We have oral warts, and these oral warts could be on the tongue, the lips, or inside the mouth. We also have things like pelvic pain, abdominal pain, vaginal bleeding, abnormal vaginal bleeding, and this bleeding could be in between periods, during intercourse, or after menopause. Now, I'd like us to look at something, which is how to prevent human papilloma virus. But before we go into that, I would like us to understand that not all patients or victims of human papilloma virus do manifest symptoms. Some people could actually be asymptomatic, meaning you could have human papilloma virus in you for years without symptoms. It's possible. And though you have the virus without symptoms, you could still transmit it to another person. Yes, it's still transmittable to another person even without symptoms. So now, how can you prevent human papilloma virus? Before we go into that, I'd like us to get on how to get human papilloma virus. How can you contact it? What is the mode of transmission? If, for example, person A has human papilloma virus, how can person A spread it to person B? Or how can person B contact it from person A? One, through sexual intercourse with an infected partner. You know, you need to include an infected partner, because if someone is not infected, the person cannot transmit. So you can actually have it through intercourse with an infected partner, be it intercourse through the vaginal, oral, or anal route. This way you can have the HPV virus, an infected person, when you have intercourse with them. That is unprotected intercourse with an infected person. Another second mode of transmission is through skin-to-skin contact with an infected person. You know, some of you like for rub skin. You want to enter man's skin. So you could get human papilloma virus through direct skin-to-skin contact with an infected person. Okay, we'll go to prevention. How can you prevent human papilloma virus? The first thing is get tested. Yeah, you need to get tested. When you are tested for HPV, when you know your status and you discover that you're negative, wow, it's an advantage for you, because it will lead you to the second stage of prevention, which is getting the HPV vaccine. We encourage everyone to make sure you do the test. We encourage all of us to do the test, the HPV test. I will not come and be telling you this is that. No. Just go to the hospital and say you want to do test for HPV. You want to test for HPV. And when it comes up negative, good, you take your vaccine, the HPV vaccine. And I want us to understand that the test is not just to dictate if you're positive or negative, but also it helps us to discover if actually you are infected and it's at the early stage. You know, because there is a way an infection would deal with you when it's still at its early stage. And there's a way it will malhandle you when it goes overhand. You know, we just say about that past Gary, yeah. So when it's earlier detected, it puts the victim or the patient at the winning side, because the symptoms and all the crises could actually be managed within a simple time frame without further complications. So when you do your test, it will dictate if you're positive or negative. It's an advantage. And if in case you're positive and it's at the early stage, it still puts you at the winning side. So after being tested, you're negative, the next thing you need to do is to get vaccinated. which is very important. And this is the highest or safest way of prevention. The safest way of prevention is vaccination. And the third thing is practice safe intercourse. By safe intercourse, we mean you should use condoms, consistently use condoms, and use it correctly. You could be using it but not consistently. And there's a possibility you could be using it consistently but not correctly. So it's one thing to use it, it's another thing to use it consistently, and of course it's another step to use it correctly. So you need to consistently and correctly use it to protect yourself. Oh, before I go, I would like us to understand the complications, some of the few complications of human papilloma virus. If you have this virus and it's not treated immediately, or if it goes overboard, overhand, if it stays in you untreated, it will lead to cervical cancer. Human papilloma virus is the primary cause of cervical cancer. And we all know how deadly cervical cancer is. So human papilloma virus could cause cervical cancer, it could cause throat cancer, it could cause tonsil cancer, and it could actually cause infertility in the long run, be it in men or in women. And there are other complications of human papilloma virus. I know you wouldn't want to experience that because it's not actually a good thing. Now, let me just cut it out. Because some people will be like, I have to be treatment, Listen, it is very unprofessional to just come online and start prescribing drugs. Most of us Africans, we are fond of this. We just want people to just prescribe to us. The best person to prescribe a treatment to you is the doctor who has you before he or she or him or her. That is the person who consults you, the person who is examining you, the person who is seeing you physically is the best to prescribe to you. And when it comes to things like this, you can't prescribe without proper diagnosis. And hey, in case you witness any of the symptoms, be it burning or itchy sensation, bleeding, in between periods, pelvic pains, warts and all that, it's not a conclusion for you to say, oh, I have HPV, No, you just can't conclude, because these symptoms also relate with other infections and other diseases. So the best thing for you to do is, when you realize you have these symptoms, go for an immediate checkup. Immediately. You don't just want to joke around with it. Go for checkup. Go get tested. And from there, we'll proceed. Thank you and have a nice day. Hey. Hope you share. Share. And of course, if you don't know, cervical cancer is dealing with a lot of women. Yeah. The HIV cervical cancer is dealing with women now in this generation. Can't be underrated. So please take this serious. Share with your loved ones, share with your neighbor, share even with your enemy if at all you have one. And don't forget to like, comment, ask me your questions. Always ask your questions and subscribe to my YouTube channel. And hey, don't forget to click the notification bar so you get notified whenever we upload a video. Thank you for having me, and remember, I'm your favorite sexual health educator, Marivon Agbo Praise. Have a nice day. See you. Ciao.